Good afternoon. My name is Jeanette Cadell. I'm a student at Jacksonville State University, and I will be presenting a comprehensive educational plan for type 2 diabetics in rural West Alabama. These are my objectives. Take a moment to review them. So what is type 2 diabetes? The body produces a hormone called insulin, in which the body uses it to pull glucose into the cells so that the body can use it for energy. So with type 2 diabetes, the body produces the insulin, but the body does not react to the insulin to pull the glucose into the cells, thus causing a rise in glucose levels. And then you have type 2 diabetes. Some statistics: 95% of 34 million of Americans have a diagnosis of type 2 diabetes. Diabetes has a mortality rate of that ranks number 7 in the state of Alabama. So therefore, the need for diabetic education is key in combating this disease. Some signs and symptoms of type 2 diabetes would be frequent urination. You're very thirsty, very hungry. You may even lose weight. You may be hungry and eating all the time, but you'll still lose weight. Blurred vision, tingling in the hands and feet, feeling very tired, sores that are slow to heal, and more infections than normal. With women, they usually have more yeast infections than any infections. Risk factors. So there are modifiable and non-modifiable risk factors. Your modifiable risk factors would be those ones that you can change. So like being overweight, you can lose weight. Having doing little to no exercise, you can start exercising and change that around as being a risk factor for you. With pre-diabetic, that's still being overweight and little exercise. And then your non-modifiable risk factors are things that you cannot change. So being 45 years or older, you can't change that. Being black or brown ethnicity, meaning African American, Mexican, or Latino, you have a higher risk of diabetes. Diabetes during pregnancy or having a baby over 9 pounds puts you in the risk factor category, or having a family history. Some associated complications of type 2 diabetes will be nerve damage. It can damage the nerves in the eyes, the hands, the feet, small blood vessels of the heart, of the kidneys, oral damage. You can lose teeth, cause bleeding in your gums, gingivitis. You can have vision loss. It can cause you to be completely blind. Heart disease, it puts you at higher risk of having a heart attack or stroke. Chronic kidney disease, hearing loss, foot damage, and it can even interfere with your mental health as well. So the implementation, what we plan to do is a diabetic self-management educational program, or DSME program. And this program entails 6 educational sessions for type 2 diabetic patients that will discuss what is type 2 diabetes, what are the risk factors, any possible complications, what are your signs and symptoms of high blood sugar or low blood sugar, or diet that you should be on, any exercise to help combat the disease, any medication that the doctor may prescribe, and any lab work or exams that you may encounter while at a checkup. Session 1, examination of knowledge. So at this time of the first session, there will be introduction. So this will be held at Marion Clinic, which is rural West Alabama. And in this clinic, they have a conference room that holds probably about 10 people that can safely social distance and be able to do proper introductions. And introductions, they would do their age, when did they find out they had diabetes, what it has been their experience been like, and if they would like to share anything else. They would take a pre-test, which it will be listed later in the PowerPoint. And then we would have like a question and answer session if they may have questions about what the sessions will entail. What if they miss a meeting for the sessions? Sessions should last no longer than 15-20 minutes, give or take. Session 2, like I said, they will learn about type 2 diabetes. What is type 2 diabetes, the risk factors and associated complications, which we discussed those earlier in the PowerPoint presentation. Okay, so like I said, you'll discuss what are signs and symptoms of high blood glucose. So which will be your frequent urination, increased thirst or dry mouth. No matter how much water or whatever you drink, you're still dry and you're still thirsty. Your sweet fruit smelling breath, you're tired, increased hunger, blurred vision, nausea or vomiting, stomach pains or cramps, and unusual weight loss, which is very when your sugars are staying high all the time. So in this event, you should know what your doctor has prescribed for you and what you would do in the event. But however, if you feel that you're having any of these signs and symptoms, first thing you need to do is check your blood sugar. And if the blood sugar is elevated, you need to take those precautions that your doctor gave you, instructions that the doctor gave in treating high blood glucose. You don't want to drink anything that has any kind of sugar in it that make your blood sugar go up. You want to drink possibly some cold water. And then in about 4 hours, recheck your blood sugar again. And if it's not going down, you will want to call your doctor or seek healthcare professionals. Session 3, continue. We'll talk about low signs and symptoms of low blood glucose. You'll be hungry, shaking, tired, you're flushed, dizzy, you're just angry, or they call it hangry. Just all of those signs and symptoms that if you were just hungry, headache. So at this point in time, like I said, they will still check their blood sugars. And if it is low, they need to try to find some kind of source of sugar. They should always keep hard candies on them. They can eat 2 to 3 hard candies, or a teaspoon of honey, or if they have some milk or anything that they can get their hands on, or even eat, if their blood sugar is low. And if you do that, you should see an increase and feel better in your blood sugar. But if not, recheck your blood sugar in 15 minutes. If it's still low, you want to repeat these steps. And if you check it again and it's still low, you still want to seek medical attention or call your healthcare provider. Diet control is very important in managing type 2 diabetes. So they'll get instructions on healthy diet control. So here you have the healthy plate. What one plate should look like. You got some protein, some veggies, should be at least half of the plate that are non-starchy, and then you should have a whole grain or one starchy vegetable, which is 1/4 of the plate. And you can have a small amount of fruit. However, they need to be careful with fruit, since fruit has its own natural sugars and can cause the blood sugar to go up, and some skim milk. Want to take heed on any kind of carbs that can run the blood sugar up. Exercise, like I said, they should, this will be one of the sessions that we'll talk about exercise for session 4 continued. They should want to try to at least get 30 minutes of exercise daily. Brisk walks. They can walk back and forth to their mailbox, around their house a couple of times, just to get themselves moving, because this will help. They want to eat a meal 1 to 2 hours before exercise, and this way it does not drop their blood sugar lower than what it is. And also still advise with your doctor on what exercise plan would best fit the patient. Medications. Doctors prescribe all kinds of blood glucose management medications across the board, whether it be pills or insulin. So in the sessions, we will talk about especially insulins, because some patients don't know how to properly administer insulins to themselves. So they will need to know the proper method to administer insulins, how to store those insulins, what they should do with the needles once they're finished, even with checking your blood sugars, what they should do with those needles once they're finished. So we will talk about all of those. If they are having any signs and symptoms from taking their diabetic medications, they should let their healthcare provider know that, okay, hey, I'm taking this metformin, but my stomach is hurting all the time and I'm going to the bathroom all the time. So they should be telling their doctor that this is going on so they could possibly change things. Okay. Session 6, we'll just talk about routine exams and tests. They will get their vital signs checked at their routine visit. They may check their hemoglobin A1C, which is done every 6 to 12 weeks. Urine test, cholesterol test, because like I said, you do have an increase for risk for heart problems. Any updated vaccines, whether it be flu, COVID-19, or pneumococcal. They would do a foot, eye, and dental exam. Daily management for patients. They should get good physical activity, at least 30 minutes, 3 to 4 times a week. Eat a well-balanced diet. Take their medications as prescribed. Checking their skin daily, their blood glucose daily. Keeping all their appointments. Knowing what to do if they're sick. And they also should wear a medical alert bracelet, because this will alert if something happens. This will alert the personnel that, okay, hey, this patient may, let's check their blood sugar. Their blood sugar may be low or high, depending on what you have going on. This is a continued educational cycle. It just talks about the actual problem and then what the cycle looks like. To get the patients educated. This plan is a secondary prevention interdisciplinary plan. Excuse me. So secondary prevention is early detection and promotion, prompt treatment of a disease at as early a stage as possible. So though they have a diagnosis of diabetes, we still want to educate them so that this can help them prevent any further complications of diabetes. So this is why this is a secondary plan of prevention. Leadership competencies. All leaders should express that they have these competencies. So communication, they should be able to communicate with the patient and with other members of the healthcare team. That's where your collaboration comes in. They should be able to educate patients on their disease process and medications. They should be a leader within the clinic to let them know, okay, hey, this is what's going on. This is what we need to do. Ethics. All patients should be treated equally, no matter their race, creed, or color. They should all be treated equally and are open to the same treatment plans as others. Professional practice evaluations. Doctors should be monitoring their education and their patients to make sure that everything is going as planned. Their A1Cs are going out with the medications that they're taking. They're taking heed of the educational plans that they have delivered to them. Resources utilization, helping them to get any resources out in the community to aid in lowering blood sugars or better management of diabetes, and quality of practice, which ties all of this together. Making sure that you are focusing on the patient at all times, providing quality care. Program evaluation. At the completion of the implementation of the project, we will monitor hemoglobin A1Cs to see if they actually became lower, and then they will also complete the post-test again, and the answers will be compared at that time. Here is the post and pre-test, which is the same test, and they'll just basically retake the same test. In conclusion, diabetic education is key to combat this deadly disease. Every patient should have their own individualized diabetic educational plan, and the healthcare providers should communicate and collaborate care for the patient to ensure that they are receiving quality care to assist in having a better quality of life. And here are my references. Thank you.